Good morning, and thank you for taking some time to join us for this webinar on emergency childcare services for essential workers and at-risk populations. My name is Stephen Profiter, and I am the Director of the Early Learning and Care Division at the California Department of Education. We all are experiencing unprecedented times, and we wanted to let you know the team at CDE is working across state agencies and with local partners to best support children, families, providers, and contractors. The team presenting this webinar and the rest of the teams in ELCD and CDNFS working behind the scenes have gone above and beyond, working through weekends and late into nights to support local programs. We thank you for everything you are doing to support children and families during this crisis. I would also like to acknowledge our partnership with the California Department of Social Services, with whom we collaborated to develop guidance on social distancing and healthy practices in early learning and care environments, as well as the prioritization of essential workers in Management Bulletin 20-06. Again, thank you all. Thank you for all that you are doing to support children and families during these difficult times. I'd also like to acknowledge the team in our Technology Services Division and appreciate all of their support for this webinar. With that, I'll turn it over to the ELCD's Associate Director, Erica Otiono, for some additional remarks.
Thank you, Stephen. I am Erica Otiono, Associate Director, Early Learning and Care Division, ELCD, California Department of Education, CDE. On behalf of all ELCD staff, I want to thank you for all you have been doing for children and families in your community. Together, we will get through this. Please continue your outreach activities with families, and remember to keep yourself and everyone else safe. Now I'll turn it over to our first presenter, Danielle Cisneros.
Thank you, Erica. Hello, everyone. My name is Danielle Cisneros, and I am a Child Development Consultant in the Policy Office here at ELCD. I will be co-presenting this webinar with Becky Halligan, a Child Development Consultant in the Learning Innovation and Improvement Office, and Alexis Loya, a Fiscal Analyst in the Child Development and Nutrition Fiscal Services Division, with the support of Crystal Devlin, a Child Development Consultant in the Program Quality Implementation Office. As we begin this webinar, we ask that you mute your microphone to limit any background noises and to please direct all your questions during the webinar to the specific content within the presentation. For all other questions, please email them to ELCD's emergency inbox at elcdemergency@cde.ca.gov. During this presentation, we will be using the Q&A function to receive your questions. Please find the Q&A feature located on your screen now. Most likely, it will be in the top portion. During the presentation, you may enter questions regarding a specific topic at that time. However, we will not be answering any questions live during this webinar today. At the end of the presentation, we will be sharing some frequently asked questions that have been received by the department thus far. Any questions asked today will be collected from the Q&A feature and may be answered in upcoming frequently asked questions. During this presentation, many web pages will be referred to, and we will be providing all of the web page links at the end of this PowerPoint in the resource section. Today, we will be discussing the following: a brief overview of the content in the Governor's Executive Orders N3320, N4520, and N4720. We will also go into a review of the key points of Management Bulletin 20-06 related to COVID-19 guidance on emergency childcare services for essential workers and at-risk populations, including some frequently asked questions and some other resources available to you. You can find this COVID-19 specific management bulletin, future management bulletins, and upcoming frequently asked questions on the ELCD's COVID-19 website. While the Centers for Disease Control denotes the virus's name as coronavirus, for the remainder of the presentation, we will be using the term COVID-19. Just a reminder, this webinar will cover emergency childcare services for essential workers, at-risk populations, and children with special needs. Management bulletins and communications covering other topics are in the process of being developed and will be shared with the field as soon as they are ready. The Governor issued Executive Orders N3320 N4520, and N4720, which during the state of emergency require that all California residents stay at home unless they are considered essential workers, defines essential workers, sustains childcare subsidies for currently enrolled families, and for a limited period changes eligibility and enrollment priority requirements for children whose parents are essential workers, at-risk populations, and children with disabilities or special health care needs whose individualized education plan or individualized family support plan includes a learning and early learning and care services. Additionally, the EO waives requirements for children receiving Child Protective Services to enroll without the need for a written referral. These changes to eligibility and enrollment are applicable for non-CalWORKs programs. The executive order also requires that the CDE and the California Department of Social Services jointly develop this guidance as well as the social distancing guidance released by the California Department of Social Services on April 7th.
Let's now look at Management Bulletin 20-06, COVID-19, Guidance on Emergency Childcare Services for Essential Workers and At-Risk Populations in a little more detail. This Management Bulletin provides guidance to early learning and care programs that will provide emergency childcare services for essential workers and at-risk populations during the COVID-19 state of emergency. These are not permanent changes to statute or regulations. These requirements are in effect until June 30th, 2020, or until the state of emergency is ended, whichever occurs first. As the situation evolves and more information is available, the CDE will issue additional guidance. The CDE is working with the governor's office to identify additional funding to support increased subsidized access to emergency childcare. Management Bulletin 20-06 applies to the following contract types: Alternative Payment Program, CAPP, California State Preschool Program, CSPP, General Childcare, CCTR, and Family Childcare Home Education Networks, CFCC. The CDE is encouraging all programs that can safely remain open or reopen to do so during the state of emergency in order to serve currently enrolled families, essential worker families, at-risk populations, and children with disabilities or special health care needs. Contractors should remind families that they expect them to remain at home during the shelter-in-place order unless they are an essential worker or an at-risk population. Any currently enrolled family that is not sheltering in place is presumed to be an essential worker. Contractors may continue to serve currently enrolled families that remain in need of childcare and enroll new families only if they have been identified as an at-risk population, an essential worker family, or have children with disabilities or special health care needs.
In addition to serving currently enrolled children, contractors with CCTR, CSPP, CFCC, CAPP contracts may enroll new families in emergency childcare, but only if such families are either 1, deemed an essential worker, 2, part of an at-risk population, or 3, a family with a child with disabilities or special health care needs whose IEP and/or IFSP includes early learning and care services. For purposes of this management bulletin, the at-risk populations include children who are receiving child protective services or who have been deemed to be at risk of abuse, neglect, or exploitation, children eligible through the Emergency Child Care Bridge Program for foster children, families experiencing homelessness as defined in the McKinney-Vento Homeless Assistance Act, and children of domestic violence survivors. 12-month eligibility does not apply for new families enrolled with the minimal documentation required as stated in this management bulletin during the COVID-19 state of emergency. Children enrolled in emergency childcare pursuant to this management bulletin can only be provided services through June 30th, 2020, unless this management bulletin is rescinded sooner or extended. This policy change is meant to address the surge in need through June 30th, 2020 due to COVID-19. This is not meant to address the waitlists or provide long-term support for access to subsidies. Providers must serve families in priority order as specified in the management bulletin. After all families eligible for subsidies are enrolled, if the provider still has space in their program, as always, they have the ability to enroll children of private paying essential workers at their discretion. When the state of emergency has been lifted, providers will be expected to resume serving all of their enrolled children receiving subsidies who have been sheltering at home during the COVID-19 state of emergency and now return to care. Any arrangement with private paying parents should consider that requirement. For example, if the direct service contractor enrolls a private pay family during the emergency because they have space, they will need to make sure that any subsidized family does not lose their space due to that enrollment when the state of emergency is lifted. Again, the CDE is encouraging that all programs that can safely remain open or reopen to do so in order to serve children currently enrolled in care as well as children provided for in this management bulletin. Any new families enrolled in subsidized services during the COVID-19 state of emergency will only receive services through June 30th, 2020. Children from families that are part of an at-risk population are eligible to enroll in subsidized emergency childcare. At-risk populations include the following. 1, children who are receiving child protective services or who have been deemed to be at risk of abuse, neglect, or exploitation. 2, children eligible through the Emergency Child Care Bridge program for foster children. 3, families experiencing homelessness as defined in the McKinney-Vento Homeless Assistance Act. And 4, children of domestic violence survivors. Children of essential workers are now eligible to enroll in subsidized emergency childcare if all of the following apply. 1, the family works as an essential worker. 2, the family requires childcare to perform their essential work. 3, the family is not able to complete their work remotely. And 4, the family assets do not exceed $1 million. Please note that if the family includes a 2-parent household, both parents and/or caregivers must either be essential workers or the other parent must be unable to provide care for the child due to incapacitation. Families who meet these requirements are eligible and may receive emergency childcare services through June 30th, 2020. Traditional documentation requirements set forth in Title V are waived. Families enrolling as an essential worker must self-certify their income in order to prioritize income-eligible families over non-income eligible families. Contractors may enroll children with disabilities or special health care needs whose IEP and/or IFSB include early learning and care services. Families must self-certify such status to enroll in emergency childcare.
The contractors should enroll new families of essential workers, at-risk populations, and children with disabilities or special health care needs by having families complete the new COVID-19 2020 application and complete the COVID-19 self-certification document, both located on the ELCD COVID-19 webpage. The contractor will use only this documentation to certify the family for emergency childcare. The application and the self-certification document must be included in the family data file. To enroll the children of essential workers in an expeditious manner, contractors shall allow for the use of digital signatures and electronic submission of applications, including supporting documentation to the extent possible. To further expedite the application and certification processes, the application should be reviewed and the family should be certified for emergency childcare immediately and notified of their recertification electronically whenever possible. Contractors should note on the notice of action, the NOA, that the family is only certified for emergency childcare services and only until June 30th, 2020, or until the state of emergency has ended, whichever occurs first. Contractors may send the notice of action electronically to the family. For additional guidance on the use of digital applications and signatures, refer to Management Bulletins 1602 and 17-13. Contractors who certify families based on a signed COVID-19 self-certification form shall not be responsible for determining if a parent or guardian's work is essential or if a family is part of the at-risk population in accordance with this management bulletin. Similarly, the contractor shall not be subject to a penalty for accepting a child whose parent or guardian is determined not to meet those definitions. The state shall hold harmless any ELC contractors that in good faith enrolls a child whose parent or guardian is determined not to meet those definitions. All currently enrolled children will have the option to stay in care or return to care before any new families are enrolled. Contractors should remind all families of the requirement from the governor's executive order that all non-essential workers should shelter in place during the state of emergency. New families who are enrolled must be enrolled in priority order and will only be certified for emergency care through June 30th, 2020. The first priority category for enrollment of new families is the at-risk populations. Families enrolled in this category are eligible for services without regard to income. Within the at-risk populations, there are 4 priorities, which must be enrolled in the following order. Priority 1 is children identified as receiving child protective services or at risk of abuse, neglect, or exploitation. Priority 2 is children who are eligible through the Emergency Childcare Bridge Program for foster children. Priority 3 is families experiencing homelessness as defined in the McKinney-Vento Homeless Assistance Act. And priority 4 is children of domestic violence survivors. The second priority category for enrollment of new families is essential workers whose total family income does not exceed the current income eligibility threshold. Essential workers are only eligible for care if their work does not allow them to work remotely. Within the essential workers, there are 3 priorities which must be enrolled in the following order. Priority 1, healthcare, public health, and emergency service sectors. Priority 2, food and agriculture, education staff, including teachers and providers of early learning and care services, custodial, kitchen, and other support staff. Workers supporting critical infrastructure, state and local government workers, communications and information technology, energy, transportation and logistics, critical manufacturing, hazardous materials, financial services, and chemical sectors. And priority 3 includes all other fields listed on the Essential Critical Infrastructure Workers List from Executive Order N33-20. The third priority category for new enrollments is families with children with disabilities or special health care needs whose IEPs and IFSPs include early learning and care services. The fourth priority category for enrollment of new families is essential workers whose total family income exceeds the current income eligibility threshold of 85% of the state median income. Essential workers are only eligible for care if their work does not allow them to work remotely. Please refer to Management Bulletin 19-03 for more information on the income eligibility thresholds.
During the state of emergency, contractors may utilize staff that meet the qualifications of a fully qualified teacher pursuant to Title 22, Section 101216.1, subsection C, in place of a teacher for the ratios listed in the Management Bulletin. During the state of emergency, to the extent possible, all groups should be stable, meaning that the same children and same teachers or staff are in the same groups each day. This guidance is applicable for family childcare homes as well as center-based care. To reduce the risk of exposure to the family, siblings should be kept in the same groups whenever possible, mixing age groups as necessary. Small and large family childcare homes may serve a total capacity of no more than 14 children. The group size may not exceed 10 children, and to the greatest extent possible, groups should be kept separate from each other. Family childcare homes should follow this guidance unless more restrictive group sizes are required by state, federal, or local authorities, in which case they should follow the more restrictive requirements. Over 10 children will require an additional staff or an assistant to maintain group sizes of 10 or fewer children. Staff are not included in the group size. The two exceptions to the group size and ratios for family childcare homes are: one, when the only infants are cared for in a group. When this is the case, the group is limited to a teacher-child ratio of 1 teacher to 4 children and a group size maximum of 4 infants. And 2, when the groups are mixed age groups and the group includes an infant, the teacher-child ratio is a 1 teacher to 6 children with a maximum group size of 6. Mixed age groups cannot include more than 2 infants. Early learning and care centers must follow this guidance on group size unless more restrictive group sizes are required by state, federal, or local authorities, in which case they should follow the more restrictive requirements. Note that the group sizes for centers do not include the teacher. For classrooms with only infants, the teacher-child ratio is 1 teacher to 4 infants, and the group size maximum is 10 infants. For classroom with only toddlers, the teacher-child ratio is 1 teacher to 6 toddlers, and the group size maximum is 10 toddlers. For preschool children ages 3 to 5 and school-age children, the teacher-child ratio is 1 teacher to 10 children with a group size maximum of 10 children. For mixed age groups that include children birth through school age, the teacher-child ratio is a 1 teacher to 6 children ratio with a group size maximum of 10 children.
Current CCTR, CSPP, and CFCC contractors are encouraged to provide emergency childcare to the extent that their contract funds support additional enrollment. At this time, there is no additional funding being awarded to direct service early learning and care contractors for emergency childcare. Contractors are required to notify their CDE regional consultant and their local resource and referral agency if they are choosing to provide emergency childcare for essential workers during the state of emergency. All groups must be stable, meaning the same children and staff should be grouped together whenever possible. Siblings should be grouped together whenever possible to reduce further risk of exposure for the family. Group sizes must be limited to 10 children per classroom or space. When the guidance from the local public health department differs for group size, the contractor must follow the more rigorous requirement. Contractors must follow any further COVID-19 related guidance released by the California Department of Social Services regarding social distancing and health and safety practices in childcare settings. If a contractor that is currently open cannot meet group size, as mentioned in earlier slides, because the number of currently enrolled families that are still attending is greater than the group size capacity, they must complete a temporary waiver. The waiver must be submitted to their regional consultant for approval. Note, no currently enrolled family should be disenrolled due to group size requirements. The waivers can be found on the ELCD COVID-19 webpage referred to in the resource section at the end of the management bulletin. Contractors who are currently closed and choose to reopen to provide emergency childcare must allow currently enrolled families to return for services before any new enrollment. Contractors must only enroll new families in the order specified within Management Bulletin 20-06. Contractors who are currently still open and providing care to currently enrolled families shall continue to serve all currently enrolled and attending families, all of which are presumed to be essential workers. They shall submit a group size waiver to their CDE regional consultant if the number of currently enrolled children that are attending regularly is above the group size capacity. They shall not enroll additional new families until the group size is less than 10 children, and they shall enroll new families as provided for in this management bulletin in priority order as openings become available, so long as the contractor has available contract funds to support the new enrollment.
The CDE and the CDSS have jointly developed guidance for contractors in order to provide care and meet social distancing guidelines in early learning and care settings. Contractors should refer to the CDSS Provider Information Notice 20-06-CCP entitled Social and Physical Distancing Guidance and Healthy Practices for ELC Facilities, which can be found on the CDSS website. The link to the CDSS pin is included in the resource section of the Management Bulletin. The resource and referral agencies, R&Rs, are a critical component to the early learning and care infrastructure and must remain open or have phone lines and email that can be accessed by employees remotely. The R&Rs will continue to provide resources to families and providers during the state of emergency. Their role includes, but is not limited to, updating the individual R&R program website to include relevant COVID-19 resources. Additionally, the R&Rs are responsible to inform the general public of available emergency childcare options and assist essential worker families and families who are at risk with finding emergency childcare. Alternative payment, AP, contractors may allow new enrollments of children for emergency childcare provided their contract funds support the additional enrollment. Families eligible for emergency childcare must be enrolled in accordance with the enrollment priorities listed in the Management Bulletin.
Reporting updates. The Child Development and Nutrition Fiscal Services, CDNFS, report forms will remain unchanged. A child enrolled in an early learning and care program with eligibility based upon the criteria set forth in this management bulletin is to be considered a certified child. Contractors who enroll children in a CCTR or CSPP program based on emergency childcare eligibility will report days of enrollment in the appropriate adjustment factor categories for certified children. Contractors who enroll children in a CAPP or CFCC program based on an emergency childcare eligibility will report the provider payments on the direct payments to providers line of the fiscal report submitted online. If there are any questions related to the reporting of the child days of enrollment, please contact your assigned CDNFS fiscal analyst. The CDE Fiscal Apportionment Analyst Directory web page can be found at https:// www.cde.ca.gov/FG/FG/AA/FAAD.ASP.
Many of you have likely seen the governor's announcement from last week about additional funding to support emergency childcare for children of essential workers and other populations. We have received a number of questions, so we wanted to address those questions here. We really appreciate the governor and the legislature identifying the additional $50 million to support childcare for children of essential workers and children who are at risk through the California Alternative Payment Program. At this time, we are still waiting for the funds to arrive at CDE so that CDE can allocate them out to AP contractors. In the meantime, we are working diligently to finalize the allocation so the funds can be issued as soon as possible to the field.
And now we will address some frequently asked questions that have come into the department. Frequently asked question number 1. Are slots for children of essential workers that are not currently enrolled temporary?
Yes, essential workers, at-risk populations, and families with children with an IEP or an IFSP that apply for emergency childcare will only be provided services through June 30th, 2020, or until the state of emergency has been lifted.
Frequently asked question number 2. Will currently enrolled children have a place in care when the shelter-in-place order is lifted?
Yes, providers will resume serving currently enrolled children beginning July 1st, 2020, unless Management Bulletin 20-06 is extended, rescinded sooner, or the state of emergency has ended. Currently enrolled children cannot be disenrolled during this time and must have their spot available when the shelter-in-place order is lifted.
FAQ number 3. Can a contractor with unused California State Preschool Program funding use that funding for general childcare to serve essential worker families?
Non-LEA contractors may request an intra-agency funding transfer between CSPP and CCTR contracts in order to utilize contract funding to serve essential workers or at-risk populations. Intra-agency transfers are only available to non-LEAs, as non-LEA agreements are not funded with Prop 98 funds. Non-LEA contractors may submit a transfer request between May 1st and May 15th, 2020. Approved transfer requests will only be for the current fiscal year. If a non-LEA contractor believes that their transfer request needs to be processed prior to these dates due to cash flow issues caused by COVID-19, they may submit a request to their fiscal analyst for consideration prior to May 1st.
FAQ number 4. Can a contractor request additional funding through a voluntary temporary transfer, VTT, to serve essential worker families?
LEA and non-LEAs can participate in a VTT of funds. VTT requires participation from an under-earning contractor who voluntarily relinquishes part of their contract to provide funding to an over-earning contractor. The VTT period is between May 1st through May 15th. Approved transfer requests are temporary and will only apply to the current fiscal year. More information regarding the VTT process can be found at http://www.cde.ca.gov/sp/re/LPC.ASP. The CDE strongly encourages contractors who are under-earning to allow their funds to be part of the support for emergency childcare by either opening up and serving families or by participating in a VTT of funds.
Frequently asked question number 5. Are license exempt providers eligible for the emergency enrollments?
Alternative payment contractors may allow new enrollments of children for emergency childcare provided that their contract funds support the additional enrollment. Families that receive vouchers from an AP agency may choose the provider who will provide care for their child.
FAQ number 6. What documentation is needed in order to certify a family for emergency childcare?
New families that need childcare must apply for emergency childcare by completing the COVID-19 2020 confidential application for emergency childcare services and complete the COVID-19 self-certification document. This will be the only documentation required in order to certify the family for services.
FAQ number 7. How should direct service contractors address physician reports and immunization records?
All center-based contractors, including those that provide services through a family child care home education network, shall collect all child health, and current emergency information required by Title 22, Sections 101220.1 and 101221.
FAQ number 8. Our program wants to reopen licensed sites to serve emergency workers, but some of their current childcare staff cannot return to work due to health or other reasons. Is there any flexibility with regards to staff permits?
Yes, during the state of emergency, contractors may utilize staff that meet the requirements of a fully qualified teacher in Title 22 in place of a teacher. For more specific information on the requirements of a fully qualified teacher, see the California Code of Regulations, Title 22, Section 101216.1, subsection C.
FAQ number 9. Are contractors required to send out a notice of action to the family once they are certified for emergency care?
Yes, a notice of action must be given to the parent when they are certified for emergency care. Contractors must note on the notice of action that the family is only certified for services until June 30th, 2020, or until the state of emergency has ended, whichever occurs first. Contractors may send the notice of action electronically to the family.
The CDE Early Learning and Care Division has developed a COVID-19 guidance and resource page that includes answers to frequently asked questions, all management bulletins issued during COVID-19, and other relevant resources at https://www.cde.ca.gov/p//cd/ELCD/19.ASP. To be informed of the updated information, please sign up for Early Learning and Care Division's email list at https://www.cde.ca.gov/p/cd/CI/PROGSPECIALIST.ASP. While new resources are gathered each day, here is a list of resources we think would be useful to our contractors. The CDSS Community Care Licensing Division webpage includes provider information notices, PINs, and all county welfare director letters, and can be found at https://www.cdss.gov/INFORESOURCES/COMMM UNITY-CARE-LICENSING. For more information about federal and state guidance regarding COVID-19, please refer to California COVID-19 response website at https://covid19.ca.gov/. The California Department of Public Health's website at https://www.cdph.ca.gov/, and the Center for Disease Control website at https://www.cdc.gov/.
On behalf of myself, Becky Halligan, Alexis Loya, Crystal Devlin, Associate Director Erica Otiono, Director Stephen Profiter, and all the staff and administration at ELCD and CDE who are continuously working to give you the best information in a time when information is changing rapidly, we thank you for taking the time out of your day to listen to this webinar. We at the ELCD like to end our presentations with this quote from Fred Rogers. We live in a world in which we need to share responsibility. It's easy to say, it's not my child, not my community, not my world, not my problem. Then there are those people who see the need and respond. I consider those people my heroes. This webinar was recorded and will be made available on our website as soon as possible. Thank you, take care, and be kind.